So we're here with Jennifer. We're here for the day before surgery. And what are we planning to do tomorrow?
I am coming in for facial feminization surgery.
How long have you been thinking about feminization surgery for?
I want to say actually probably for about 10 years. It started with a desire to kind of change my nose.
Okay.
And then it kind of like, I would catch myself in the mirror and be like, oh, that probably needs some editing.
Are there certain parts of your facial appearance that are especially bothersome, especially problematic to you?
Yes, definitely my nose and my profile. I really don't like my slopey forehead.
Do you mind if we ask when you started transitioning?
Sure. I started when I was 14 and full-time at 20. So I started dressing and kind of dabbling as a gay boy when I was 14, and then at 20 is when I started living and dressing full-time and also taking medications. I also feel like, you know, over time, like when I was younger, I had a youthful face, and now that I'm getting older, you know, more of the aging kind of disparities that happen with as you age, your nose gets bigger, these become a little more prominent, like we're just becoming more and more prominent.
Yeah, it's another interesting concept that you bring up. So youthfulness and femininity are also kind of locked and intertwined in these ways. And so kind of dialing the needle on one way and one for one will also help with the other. So it's a lot of stuff to do.
A lot of stuff, so excited. Yeah. I want to emphasize that, you know, transition is just as much about making changes, but also being happy with the person that you are before you start seeing changes and you continue making changes.
I think anyone who's watching this video should really rewind and listen to that again, actually.
I've been very happy, but I also feel like, you know, you can always improve.